Hi everyone, Dr. Emmy from Pain Free and Fit and Posture Size. Welcome back. Today, part 3 of our ongoing series on early morning warm-ups for degenerative disc disease. We're going to take the concepts that we learned in the last 2 segments and blend them together today, talking about low back stabilization with hip and full body movements to warm your body up, avoiding injury. Hope you enjoy. So in parts 1 and 2 of this series, we talked about our early morning warm-up for degenerative discs to make sure that the fluid that imbibes or comes into the disc isn't abnormally, because it has increased pressure to the disc, isn't abnormally pushed out against those disc fibers and doesn't irritate your degenerative herniated or bulging disc first thing in the morning because you're moving your spine incorrectly. In phase 1 of the warm-up, we want to make sure we're gently mobilizing the lower back joints, disc fibers, and other soft tissues. In phase 2, we talked about last time, we're going to activate the hip muscles and the leg muscles, as well as the hip and knee range of motion, so the hip can bend and it can take the brunt of the load of bending and moving, and the proper muscles of the glutes and the glute medius are activated, taking pressure off of the lower back as you begin to move during the day. In phase 3 today of our warm-up, we're going to finish our warm-up off with combining lumbar stability or low back stability with hip motions and global full body motions. That way you're totally ready for the day with your warm-up. Again, this whole warm-up, phase 1, 2, and 3 collectively, probably takes no more than 3-4 minutes to do. It'll be the wisest 3-4 minute habit you have first thing in the morning with degenerative disc. It usually makes a lot of a difference in terms of how much your degenerative disc will bother you during the day if you do a proper warm-up first thing in the morning getting out of bed. So, in phase 3, let's talk about lumbar stability. We have all a neutral spine that's unique to all of us. Some of us have a tendency to have our tail up. Some have a tendency, because of sitting, to have one leg go out more than another, have a tendency for one hip or rib cage to lean one way. We all have these asymmetrical body habits. We all have these muscle imbalances. Unless you know where your muscle imbalances and alignment posture issues are, you can't put yourself into a neutral spine. Neutral spine means that in 3 or 4 different planes of motion, tilting back and forth, leaning side to side, twisting, and then translation or shifting the body, you need to get yourself in a position that's the center of your safest zone that doesn't aggravate pain. If you don't know what that is, go to the Pain Free and Fit and Posture Size website. We've got a free body analysis that'll help you develop a neutral spine position. So once you know your neutral spine position, you're going to engage it, and we're going to now put in that hip mobility that we just gained in the last phase of a warm-up together into one motion. And there are 2 basic motions we're going to use. We're going to use a squatting pattern, which is maintaining our low back stability and allowing our hips to drop back into a parallel hip squat, okay? Squeezing the glutes to come up. And I can do about 5, 6, 10, 12 reps, somewhere in that range. And again, what I'm doing here is I'm integrating the 2 things that I did. I put a little motion in the low back, and then I've sealed it with stability. I've taken my hip joints and my leg joints, and particularly my knees, leg muscles, activated them so I can use my glutes more than my low back as I do a couple squats. And I'm phasing them together so my whole body can move as a unit, getting ready for the day. I can also use a sumo squat motion where my legs are apart. Again, if I have a tendency to externally rotate one leg more than another, make sure the position of my squat doesn't have that leg out more than the other side. They have equal angles. I could use a parallel hip squat. If my leg has a tendency to rotate out on the left more than the right, I want to pigeon toe that foot and perform a few squats there. Again, the kneecaps travel in the same direction that each toe travels in. I can use a lunge pattern where I have one leg forward and one leg back, stationary lunge or split squat, and move up and down. Again, what I'm focusing on here is using that lumbar stability, neutral spine, and maintaining it as I go through these motions. With the lunge, remember, you want to make sure that the front hip does not have a tendency to hike up, but you keep it down and level, and that the front rib doesn't drop into that side, so you're keeping equal distance between the top of the pelvis or hips and the lower rib cage. And I'll take a slow pattern. I don't need to go fast. I don't need to do 20 or 30 reps of each of these. Maybe 5, 6, 10, 12 reps, 15, 20 reps at the most. I can integrate upper body with these 2 squatting lunges. For my sumo squat, I can use more of a clean and press kind of a motion where I'm maintaining neutral spine, coming down with my hands to one side of my knee, back and front, coming up, and then twisting with my pelvis, making sure I keep my pubic bone and belly button aligned, and my mid-back to go up and forward. and then I can reverse that. So again, I'm keeping stability in my low back. My pubic bone and belly button turn together. If my belly button turned more, I'd feel the pull or the rotation in my low back. I want to lock or stabilize that portion of my spine and let the motion come from my hips and mid-back. This is preparing the whole body for rotation and twisting during the day, not only by warming up the joints, all the soft tissues, getting them used to turning, but also neurologically to start my day off by saying, hey body, I want to practice and coordinate you in the right types of motions so that when you go to move here in the morning, whether it's down at the gym to work out or whether it's at home with your daily activities, you're moving in the right way. I've primed the muscles, I've activated the normal movement patterns that are healthy for me and avoiding the ones that typically are going to happen if I don't warm these up. I can also do that from a lunge or split squat position. From a lunge, after I do a few reps up and down, I can also go up and to the sides. Okay? Here again, I'm keeping belly button and pubic bone together, rotating a little bit from my pelvis and hip and my mid-back. So this is a full body warm-up. I can take a sideways lean, bending both legs, bend one knee more than another, tilt my pelvis so my pelvis drops on one side, my butt on that side will drop, maintaining an equal distance between the top of my hips and my ribs, and do a sideways motion. So again, I've got rotation, drop the other hip down, I've got flexion, extension with the normal squat, and I've got a little this lateral flexion. So I've got all these patterns. I put these three phases together. My low back mobilizations, phase one, then I go right into a few of my hip standing range of motion patterns, mobility patterns, and I finish that off with a few either squats, lunges, or both going back and forth, 3, 4, 5 minutes at top, and my body is warmed up. My back right now, the small spinal facet joints have a little motion in them from phase one. My hips are loose, the proper muscles are activated, and I've now coordinated upper and lower body, full body movements to be able to move. That's the way with degenerative disc disease we should start our days. That's the warm up now before we go to the gym and work out, or go out for a walk, so whatever we're going to do. We're properly activated, our lower back is going to appreciate that. We've distributed fluids in the disc as we're compressing in the standing position in the correct way. The proper disc fibers are being torqued on one side as opposed to another in a more symmetrical fashion, and we've activated all our stability muscles to protect our lower backs. If you like this video on putting together a nice early morning warm-up program for you to prevent your degenerative disc disease, bulging discs, and herniated discs from irritating you, feel free to subscribe to our channel. We've got a lot of great videos out there. Give me a thumbs up below if you'd like to help me share this valuable information with others. And remember, the Fast Track program available at painfreeandfit.com is the ideal program if you're looking to figure out what are my muscle and imbalance issues in my body. Where do I not stabilize my low back correctly? Almost everybody has these instability issues, and they're unique for all of us. That's a great program to learn a good self-analysis, figure out what's going on with your unique mechanics as it relates to your degenerative, herniated, and bulging discs, and how to put together a sequential exercise program of self-rehab in terms of stretches, coordination exercises, balance exercises, strengthening and endurance exercises, and special exercises of how to take where you are now and build yourself back up into getting really physically fit, getting more demanding on your body, getting back into sports, and pushing your body without hurting your lower back. I hope this program on warm-ups for degenerative disc disease helps you with your chronic lower back issues.